Okay, so we have Sharif and Rebecca. Sharif, tell me who you are, Sharif, and what do you do?
Yeah, my name's Sharif. I'm a core surgical trainee on an orthopedic theme, and I'm currently on my plastics rotation.
Great, and all right,
I'm Rebecca. I'm an ST4 here in Norwich, currently in the breast firm.
okay. Why don't you tell me what we're going to do?
Yeah, so from what I understand, we're going to be doing a left breast reconstruction to the previous LD flap and an implant. So we're going to take that out and we're going to do a PAP flap.
Great.
So yeah.
And do you know what PAP stands for?
Profunda Artery Perforator.
Perfect. And can you remember how we marked a PAP?
Yeah, so we mark the patient and you go from the groin crease to finger breadths, distal to the groin crease, and then you mark your upper incision. And then you listen after the perforators and you can go, the skin panel is about 8 centimeters down from that edge. And then you can go down further depending on where the perforators are.
Fantastic. And what do you think is going to be the trickiest part of this case? Because we haven't started yet.
We haven't started yet. I am aware this is quite a tricky flap with quite small perforators. I think the flap raise could be the most challenging bit to get decent perforators that we're happy with, and also being able to get a good size volume, so we might have to take 2 flaps bilaterally.
Perfect, that's ideal. So we're going to do another talk afterwards to see how it all went.
Yeah, we'll see.
No?
Good luck.
So we have finished the PAP reconstruction. Now, can you introduce yourself? Because you weren't here at the beginning, were you?
Yeah, I am Kazan. I'm a F1 on Taster.
Okay, great. And we know who everybody else is. So what did you learn about the case today?
So I think,
Can you remember what we did?
so we did a PAP flap.
Yeah.
I think the one takeaway from today would be, first of all, raising the technique of raising a flap, identifying the perforator, and in general, just learning more about the lower limb anatomy.
Very good. And what did you enjoy about it?
Enjoy working with the team today. The microsurgery is definitely very cool, even though I'm not involved in it. So yeah.
So Rebecca, who did a bit of micro today with me, tell us what the procedure actually involved.
So the procedure involved raising it out from the upper, inner and posterior thigh, identifying the best perforators that we can find with both clinical view and Doppler, and then plugging that into a chest which we have previously prepared. In this particular patient, removing an implant, freeing up the previous flap, and then going in between the ribs and identifying the vessels and freeing them up, and then connecting those endomax.
Great. What do you think was quite tricky today?
I think from my end, who I was dealing a lot with the chest vessel prep, I think it was the most challenging thing was that this patient had previous reconstruction, both in terms of an implant and a previous flap, which altered the anatomy a bit. It also altered the tissues a bit. There was a capsule to take into consideration, so that was new for me. So that was a big challenge.
And she had an LD flap, didn't she? So she wasn't a free flap. That was causing the problem. How about you? So what did you enjoy about today? Or what did you learn, first of all?
So what was the indication for a PAP flap? So obviously we see a lot of DIPs on the on-call or during night shifts where you have to monitor them. So it's the first PAP flap that I've seen. So one of the main indications for it is they've had a previous DIP. So I'd learned that as well. And yeah, the use of Stratifix actually to close, I've not seen that before actually. So that was something novel for me as well.
Great. And what did you enjoy about it?
I think like Keza, I really enjoyed working with the team. I think everyone had their role, the importance of communication, teamwork. It was a good case.
Right.
Tiring, grueling, but good case.
Yeah. So do you think we should do more?
Yeah, definitely.
Definitely.
If you're here, let's do it.
All right then. Well, thanks guys, and I'll see you
Thank
later. Bye.